Hi, Mel.
Hi, Miss. Good evening.
How are you?
Good, I'm good.
Okay, great. Mel, I have some questions for you, okay?
Mhm.
Maybe we can start with how do you think? Well, you're from
Peru.
Peru.
Mhm.
Okay. I don't know if it's the same as here, but we are getting on the fifth wave, I think. I don't know how is in your country of COVID.
About about the COVID, here we have the cases are increased. In the last months, we have a lot of cases in the hospital, include the level one. But here we have a lot of people have the third vacune. So
Así?
that's yes, with paracetamol help a lot in the people. Uh, so here in Peru, in the capital, obviously is the place that we have a lot of cases, but it's controlled. It's not like the first time that we have a lot of people that every day dead. So it's more easily to control all the cases. Mhm.
Okay. So, can you describe how is the manage of COVID in your country?
How is the managed? Well, we distribute the cases of the level that the patient have the symptoms. For example, is it's only like a flu.
Mhm.
We can treat it in the home. It's not emergency. The we can call every day to ask how is it going, if the symptoms are in the same level, or maybe have a, a worse situation, or but we are focused in all the 60 or 70 years in the old people, because they have a lot of other pathologies, no? Maybe they have diabetes, or maybe asthma, or other symptoms that can can be worse, all the diagnosis, no? But other other ways that we manage the situation is the vaccine, is for example, in the school, the the young people don't doesn't go to the school every day. They have virtual classes for in right now we have to see not only the COVID, we see the sarampion virus that is common. Well, here it's common. We have, I think, like 20 cases in the capital, so it's important to consider it that too. Mhm.
Okay. Okay, thank you, Mel. Um, well, I don't know, but do you still make some promotion with in health, like wash your hands, use the mask, and those things, or they are not using anymore
Yes.
masks?
Mm, to be honest, I see the people in the street that they don't like use the mask. We can recommend it, but they don't use it. Some people use only one, the common mask that it's only about uh, tela. No, doesn't have the filter. It's
Okay,
only with the
filter.
fabric. Yes, and it's not recommended that kind of mask. But if they, for for example, the wash the hand is very common. Even in the shopper has a they are include a little bathroom with soap and water to the people in the street can wash their hand. That help a lot. Mm, the vaccine, like I mentioned before, it's very important in the center that they they can vaccine. It's doesn't have people because a lot of people have the three vaccine. Mm, the well, here in Peru we have problem with the alimentation. The prices of the food it's a little higher than before. So
Recently?
yes, we have problem with the government. So doesn't help that people can uh, have a healthy diet. So maybe that's one of the problems with the cases, no?
Yes, I can understand. Okay, I will put in the chat how we can call una mascarilla de tela. Okay, cloth face mask. Just to let you know.
Oh, glove famous. Thank you.
Yes.
Okay.
Okay, and well, since we were talking about mental illness yesterday, um, what can you
Yes.
tell me about depression? What can you tell me about that?
Well, the depression is very common, I think, not only with the people that but the young people like like we know it can present in all the age. It's a silent illness. It's not. We can see it. We have to ask how is the person include in the for the diagnostic. I think that especially have to diagnose
Diagnose.
diagnosticar the diagnose. Yes, have to do it specialized because have a lot of symptoms and a lot of uh, characterize uh,
Characteristics.
yes characteristic to be the formal diagnosis. The depression include the person who smile every day can have the depression. Is not it's very dangerous. I think that it's most common or is have a high level in the Asia continent. For example, Korea or maybe Japan, because they have a lot of pressure in the world. Here in the Latam, maybe because uh, the kind of people that we are, I think more warm, maybe more friendly. It's not obviously, but it's important. The health mental is not uh, n- is not look good. For example, in the laboral area, but it's very important to have a red flag if we have some signal about that.
Okay. Okay. And do you think there is a difference between depression, just depression, and major depression or
Uh,
major depressive illness?
yes, I remember that the difference is the intensity, the number of the symptoms, and for example, the only the depression you can treatment with therapy. It's a conjunto between the yes,
Conjunction. Okay.
between the psychiatric and the psychology. We can use the medicament, but the major depression is most difficult. Uh, um, the the person have to intern to the hospital because in any moment can risk his or her life. Um, include in the major depression I think that you can see it because it affect all the factor in the life, no? Maybe the uh, the inspection, the people doesn't care about be careful with their hair or with the diet, in the clothes is not uh, care the people don't care the clothes, uh, the hygiene is not healthy.
Hygiene.
The hygiene, the hygiene is uh, bad. It's very bad in that people, obviously of all the problem that have. So just have a lot of difference.
Okay, and this um, can be maybe a reason why people commit suicide, right?
Exactly. Yeah, that is the the most problem, or maybe the preoccupation about this kind of illness.
Okay, okay, man. And I want you to pick up one mental illness and describe maybe the characteristics of this. I won't ask you about a treatment because you're not a specialist, but if you want to tell some suggestions, that would be good. Okay.
Mhm. Um, for example, uh, I can talk about the anxiety. For example, the anxiety and the panic in some cases are uh, having interrelationship. No, for
That's one thing.
example,
Anxiety.
anxiety. The anxiety, for example, can interfere with the diary activities. Is depend of the level, uh, can be difficult of control it. Um, a lot of people think that is not a real danger, or maybe don't have a lot of oh, I can see the
Yes, no
the question.
worries. While you're telling me, because you have few minutes, you can feel it, okay?
Okay. Okay, so I continue. uh, okay, a lot of people think that the anxiety doesn't have a lot of problem, but in to the person it's very difficult to control it. The person have a lot of symptoms. For example, they have uh, like like tachycardia, but not a lot, but it's similar.
Okay.
Have for
Harder to
example,
function.
yes. For example, they sweat in the head or in all the body. They have fear without reason. Uh, in some cases, the anxiety can be presenting in any moment in the day, to have without reason. So it's difficult to have the dire activities. Maybe can be present in the school or in the work. Uh, we can treat it with medicament, and we have medication. We can talk with the person, maybe why uh, what is the reason, no, to this anxiety. Maybe have a specific causes, so we have treated about that causes. And the anxiety uh, present in different ways, but is fortunately is treated. So we have to be careful with that, no, and we have to talk it with a specialized, or maybe with a familiar, to better that illness.
Okay, to help them.
Mhm.
Okay, thank you so much. And now can you please fill my questionnaire? And
Yes,
Melanie,
miss.
you're improving. It's much better from the last classes, but we still need vocabulary. okay? Don't
Yes.
translate. Try to not translate the words, because when we do that, we lose focus, okay? And it sounds a little bit different and difficult for us to make us understand. But when you think in
Yes.
English, just speak and it will flow, okay?
Okay, Miss. Yes, I lost the questionnaire. I don't know why.
I will
Mm,
send it again, no worries.
yes, please. Okay.
And I will take a picture and then thank you. Remember that this is our last week of this level, okay? And tomorrow I will tell you when it's gonna be the test, okay? And just try to practice, please. A little bit more vocabulary and pronunciation, and it will be so good to the next level, okay?
Okay, Miss. Thank you so much.
Thank you, Mel. Take care. Have a good night.
Thank you, Miss.
Bye-bye. Hi, Claudia.
Hi, teacher.
Thank you so much for coming. Okay.
Thank you.
Okay, let's talk about maybe, well, have you noticed that the fifth wave is increasing? Fifth wave of COVID?
Yeah, I noticed about it. Yeah, we have a lot of cases at the hospital, but it's the Omicron variant.
And it's not so hard, I think, as the other one. I don't remember the name.
It's not so severe like Delta variant, but it's. Did you have COVID?
Yes, maybe 3 weeks ago. Yeah.
Yeah. Maybe you have a really hard sore throat and fever.
Yes, fever. Yeah, I was with so much pain on the knees. What else? Yes, I can smell till now. I think a little bit better than before, but feels like that. I cannot smell my food.
Yeah, but because Omicron has a horrible sore throat, fever, I think that's all. If you are vaccinated with the three doses, and if you have risk factors like other diseases like hypertension, diabetes, um, yeah, and you only have two vaccines, it's probably that you can develop a pneumonia.
Yeah, but I think it happens something like that to me, but I haven't a sore throat or cough. Just after that, yes, I after I finished with this condition, I have a little cough, and then I have maybe, I don't know, but my saturation was good, but I had tachycardia and a little pain on the chest, and it was hard to breathe. But now I think I'm better. Just
You feel better.
yeah, just a little cough that it's annoying
Like
me.
you didn't need oxygen support.
Not at all. But sometimes I felt like I need it, especially
Yeah,
with the mask.
I think the problem with COVID is like that the virus attack the human immune system. So if you have some diseases that are not that you didn't develop but you have in your genes, like diabetes, like arthritis, rheumatoid arthritis maybe, or another diseases, for example, leukemia also. Uh, COVID, COVID can helps that you develop those diseases that you didn't. That's the problem of COVID. I think actually not the pneumonia, the problem that you can die for a pneumonia. I think that's the real problem, because at the intensive care unit we have maybe 4 or 5 cases of people who died of leukemia after COVID.
Leukemia.
Leukemia, really. So I think that's the real problem. I know a nurse that has rheumatoid arthritis now, and another colleague that developed diabetes one
Wow.
after COVID. I think that's the problem now with the virus, and we don't know the big picture. We can see it now. Maybe in 5 or 10 years we will see the 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 how big.
Was the problem in our systems, right?
Exactly.
Okay, I hope not to have any of those illnesses.
No,
But
nobody wants it, you know.
yeah, I thought it was a little bit hard this time because it's the second time that I have it. But yes, I have fever and I felt so bad. Just one day, maybe, and then the cough and the knee pain. But just one day, and then I felt better. So
Super.
okay,
Yeah, that's good.
yeah. And talking about yesterday, now that we don't have enough time, but that was good. I was actually talking about this topic too. Okay, can you describe any illness, any a mental illness that you remember, please?
Okay. Maybe anxiety.
Okay.
Well, anxiety is, I think, a public health problem now, and it has affects so many people of different ages, you know, and sorry.
Sorry, while you're speaking, please.
Okay. um, um, affects so many people. It has a lot of treatments, specifically with therapeutical sessions with a psychiatrist. But I think the more dangerous in a person is the uh, acute anxiety attacks. That when the person can control itself, so it has so many thoughts, and the person feels that can't breathe correctly, and sometimes it has a little of tremor and starts to cry uncontrollably. So I think the most risky is when and where the anxiety attacks can present of that person. So, for example, have a colleague that presents an anxiety attack at the operation room, and she can go out because it was a hip surgery, and you can get out of the operation room. So it was so difficult. We had to replace her, and until she can control that attack. And sometimes we use, or it's most commonly used with benzodiazepines, like clonazepam, for example. Also, it helps a lot the feeling of the water, the cold water in the neck or in the face. It helps a lot to the patient, and count things or that you can see in the room, for example, one book, one chair, or those things that makes you bring your mind to the present.
Okay, it helps to that person.
Yeah, that really helpful.
I think maybe some artists have it, right? They cannot control it themselves and they just start. Oh, sorry, Claudia, but thank you so much for coming, okay?
Okay, thank you,
See you.
teacher. See you tomorrow. Bye.
Bye-bye. Take care. Hi, Mateo. Good evening.
Hello, teacher. Good evening.
Hi. Okay, Mateo, have you heard about the increasing of cases of COVID?
Yeah, I think I'm one of those cases.
Mateo, what happened?
I
Where?
don't know. I think my father got COVID in his work, and then he passed it to me. So I'm
Oh, no.
really, yeah, but I don't know, because he has nasal antigen positive.
Mhm.
and my test was negative. So
weird.
yeah,
I think at first, when it's in an early stage, it always maybe it's a negative result, and by the days, I think it changes, right? It happened to me.
yeah, it depends, it's like if you took the PCR, it's more probably that you have your true positive, say that way, your true positive result after the first 5 days of symptoms, I think.
Okay, but how do you feel?
I'm better. Yesterday I was a little unwell, but it wasn't too strong.
Okay, and how is your father? I hope he is well.
He's really well.
Oh, that's
He
good.
just have sore throat and just that.
Okay, and do you have this symptom that you smell
Yeah.
normally?
Normally.
Okay. First time I got it, it was like you. I think just a few days maybe, but then I was so good. But now, 3 weeks ago, I COVID, and now I cannot smell very well.
Oh, that should be very stressful, or I don't know. It's
Kind
not
of.
that, yeah, not that well.
Yeah,
Even
but
the food doesn't taste the same.
yes, that's right. Okay, so how can you describe the management of COVID in our country?
Yeah, so the management, it depends for the severity of the case. For milder cases, it should be just symptomatic treatment, like ingest of analgesics, like NSAIDs, and pretty much that. If it's a little severe case, like with pneumonia and other associated infections, you should prescribe an antibiotic, like ceftriaxone. And for really severe cases, patients should be admitted to UTI, and the treatment there is with mechanical ventilation and monitorization 24/7 until the patient recovers or not.
Okay. And do you think it's important that we still make the promotion of health in these cases and orientation?
Yeah, of course. We have to promote health to prevent illness,
Yeah.
I think it's the most efficient and cheaper decisions we can make as a country.
Yes. Okay, thank you, Mateo. And well, what do you think about, or what do you know about major depressive illness?
Major depressive illness. So it's a mental illness that should accomplish some criteria. I don't remember exactly the criteria, but there's like generalized mood of being of feeling empty and useless, and some kind of anxiety too. So I think this is a very underdiagnosed illness around the world, because I don't know if it happened to you, but during the studies, sometimes you don't get the scores you wanted, or you just had a fight with a friend or with a couple, and it's a vulnerable stage in everybody's life. But I think that not everybody wants to go and seek help to get diagnosed and properly treated.
Okay, and do you think it can end with suicide?
Yeah, in some cases, it might end in suicide. There are the most severe cases, of course, and I don't know. It depends in the what the person is passing through in his life at that moment.
Okay. And I know you're not a specialist in this area, but maybe you can suggest any treatment or how we can deal with this illness.
Well, I think the best management should be go to the psychiatrist or a specialized psychologist to get a therapy, and if it's necessary, the psychiatrist should prescribe antidepressants. That has some good and some bad effects. Some of them are addictive and can cause intoxication and other things, no? But I think therapy is the most. I think a good therapy can cure the depression.
Perfect. Thank you, Mateo. And the last question, can you name one tendon reflex and maybe describe it?
Okay, so I'll name the patellar reflex. That is a muscle reflex that is generated when the physician hits the patellar tendon or the quadriceps tendon above the patella and over the tibial tuberosity. This should make a response of contracting the quadriceps muscle and extending the leg. It is useful to diagnose some medular damage, maybe some nerve damage, but it's commonly for medular response.
Okay, in that case, does anyone maybe have no response at all?
Yeah.
In cases, you name the one.
Okay. Let's imagine that the patient is an older person, and maybe that patient had a vertebral fracture, and and sometimes we'll have some stitches from the bone and damage the corticospinal tract, and this lesion should damage I think it's called the pyramidal way, and if this zone is damaged, the reflexes are absent. Or sometimes when there are electrolyte disturbances, sometimes the reflexes are increased.
Okay, thank you, Mateo. Thank you so much. I will send to you my questionnaire, please.
Okay.
Fill it for me, and I will let you rest. Okay.
Okay.
I hope you feel better for tomorrow. Remember, we have classes, theoretical classes at the same time as always.
Yeah.
And after that, we have the practical classes. Remember, for at 9:30.
9:30.
Okay.
Yeah. Okay.
Let me know if you make it or if you feel bad or something. Okay.
No, I'll make it.
Okay, that's good. Thank you. Have a great night and see you tomorrow.
Thank you, teacher. See you tomorrow. Bye.
Bye.
Hi, Rina. Good
Hi,
evening.
teacher.
How are you?
Fine, teacher. And you?
I'm pretty fine, but it's cold here. So I have to be like a bear.
uh,
Okay,
you have cold and I have hot because it's very intense the temperature here.
oh no.
Yes. Excuse me?
How much is it?
Oh, according with the thermometer, the temperature, no, I cannot see it yet, but it's terrible, terrible.
We are here at 11.
Yeah,
And
I
the-
would want to stay here.
Okay, let's talk about, I don't know how is in your country about COVID. Is there increasing the cases?
Yes. Uh, in this in the country, the minister of the health called increase like the fifth wave, la quinta ola, or the fifth increase, the COVID. But this new kind of virus, the symptoms are very slow, but and precisely that is the reason, because the people doesn't go to the hospital in the time. So I believe in the cases is more than they show. But yes, in fact, we are not the obligate to use the mask, but
Okay.
now the use is obligatory now.
Okay.
Mhm.
Just because of the fifth wave.
Yeah. In your country, how is the COVID?
We're in the same wave. And I heard that it's increasing. That's why I'm asking you. And I want to know how is the management of COVID in your country?
Well, the logistic or the treatment mainly is if you have the symptom, you show the symptom, you have to attend in a clinic public, and they have they send you a test, the PCR test, and if you have positive, they make you, they write in una constancia or in a letter,
Okay.
that in a letter that letter says that you have to stay in your home 30 days, sorry. Yes, 30 days approximately, like a quarantine. Yeah, like a little quarantine, and give you a package of the treatment that is have a little drugs like acetaminophen, ivermectina, vitamin C, vitamin D, zinc, and a little piece of papers with some indication that you have to follow if the symptoms get worse. Yeah, that is the case if you have the symptom. If you know the symptom, but you have the test positive, it's only you stay in your home 30 days, but with teletrabajo. You work in your home office. Mm-hmm.
Okay. 30 days or 13?
No, 30.
30 days.
Yeah, it's a big period of time for me, because before it was to 2 weeks, 15 days, but now in theory, that calls aislamiento domiciliar. It's not precisely a quarantine, but for that reason, and because the people don't obey the indication, I think it's for that 30 days.
Okay, it happens the same, but here we have like 2 weeks, and just that. They won't give us anymore. In my case, just 1 week, so I have to back to my work with my negative result, of course, but in 1 week. Okay.
Okay.
Okay,
And
I go.
Yeah, I have a question. In your country, you have to how many doses of the vaccine you have to have? Do you have? Yeah.
Okay, I think we are on the 4th doses, 2 obligatories, and 2 if voluntaries, right? But I have the 2 obligatories, but I got COVID, so I have to wait for the 3rd vaccine.
Oh, okay. The same. It's the same way here for doses, but 3 it's obligate. It's you have to take 3 doses, but the 4th, sorry, is if you want. Yeah.
It helps a lot.
Sorry.
It helps a lot to have the vaccine.
Yes, in fact, that is the reason, because the symptoms are soft, or yeah, are soft. It's not the people doesn't complicate.
It's not as hard as the first time that we didn't have any kind of vaccine, right?
Yes.
Another question about this. What do you think about the ivermectin?
I believe that is a bad decision to use or to dosificate to the for a people who has COVID, because ivermectin is used for another situation and have a effect adverse very complicated, especially with the liver and the kidney. And that is for me, in my opinion, it doesn't recommend it to take ivermectin if you have COVID, because there is not studies. It is not researchment 100% secured that the ivermectin works for the COVID. But in that moment, ivermectin is one of the multiple drugs that the scientists are looking for a possible cure for the COVID. But now, no, ivermectin, no.
Okay, and in like in preventive cases, or not at all?
Sorry, prevent?
Yes, to prevent. Can be used to prevent, or not at all?
No, not at all.
Okay, got it.
Yes.
I think this drug is used for parasitosis.
Yes, with scabieusis. Well, scabieusis is one of them. And for that reason, I don't know how ivermectin introduced for COVID. I don't know. I don't know what is. Yes.
Yes, that's weird. Okay, thank you so much. And we have 3 minutes. I want to ask you about any kind of mental illness you want to tell me about, okay? I know you're not a specialist, but you can give me some suggestions of treatment maybe for this condition.
But I think about depression. Well, about all the illness that you have to treat for the psychiatric area, it's very complicated because all these kind of disease that affect in the mind, it's are similar, but it's not, and the treatment is different. For example, depression, it's a illness that the people suffer the depression. It's very difficult that recognize that have depression, precisely for the society, because for the wars, because the society show us that the stress is something common. But if there is a different test I can use for the person that I suspect has depression, and if the tests are positive, the treatment usually start without a treatment without drugs, no drugs at the beginning, or depend the level of the depression. For example, on the person has a depression low. The treatment starts with attend a date with a psychologist, because in that kind of person, the treatment it's a mixture between the techniques for the psychologist, because a psychologist show you techniques, procedures, or any situation or activities for the mind. Yeah, and the another part of the treatment is with psychiatrists, and psychiatrists is not precisely this prescribe drugs. They have to see the person and start with if the person needs drugs, it's a dosage, or the psychiatrist indicates in a low dosage. I don't know in another country, but at the moment in my country, if I detect someone with depression low, the first moment is show different techniques about the, for example, I don't know if you heard mindfulness. There is mindfulness. So use that kind of technique. The another one is close with the patient, make a rapport. I have to be empathy with the patient, and after that I have to show the tendency for the person, because the depression, the person probably has a compulsive appetite, or use drug, or is a tabacist, or consume alcohol, and according with the kind of patient, the next step is probably prescribe some drug, but in a low doses, because I can prescribe that kind of drugs, but that no with no letales, no drugs are very soft for the treatment. But the depression the treatment for depression takes a lot of time. It's not in a treatment for 3 weeks, 2 weeks. It's a process. But that is in a kind part of the treatment. Yeah.
Okay, Rina, thank you so much for sharing the information with me. Okay, and see you tomorrow.
Okay, teacher, see ya.
Bye-bye, take care. Hi, Jorge, good evening. Sorry.
Hello, good evening. No problem, it's okay.
How are you feeling now?
I'm feeling better, thank you.
Okay, that's good. Now, Mateo, it's with COVID.
Yeah,
Oh.
I thought he's my friend, and I talked to him, and he told me, I hope I wasn't the problem, because we met like a week ago because of my birthday, and I hope I wasn't the problem.
No, just
I
kidding.
hope so.
He's feeling better now. He
Okay,
told me that yesterday was bad.
yeah,
a bad day.
he told me so.
Okay. What have you heard about the COVID situation? Of course, you did. And what do you think about that? How is the management in our country about
Well,
COVID?
now I think due to the vaccination system and everything, I think it's going better because I think it has psychological impact too. You know, always when people say I'm sick, I'm feeling sick, it is really important to be mental like stable to handle any kind of illness, in this case COVID. You know, all the media and all stuff and all information from the internet was also important to how people acted during the COVID. So I our management I think is like treating flu, just not nothing different. I suggest that in and also of course the quarantine, you know, so you cannot be contagious to other people.
Yes, okay. And what about preventive things like promote health and those kind of
Yeah,
things? Do you think it
yeah, of
works?
course, yeah. Maybe like we we're like more aware of from like we're more aware than other countries because for example in the US they don't wear face masks on the street. They only wear face masks in public places. I think nowadays they're not even using face masks in I don't know, for example in a restaurant or in a cinema, and they're doing good with COVID. So I think we should stop like being so worried about it. Like just take it as a flu as it is, and I think yeah,
Yes,
that's
I think the same. It will be better now. But I felt so bad 3 weeks ago that I have COVID. I got
yeah.
it, and I felt like pain on my knees, and I got fever. So it was a little bit different because I usually got flu, but not. It happens like every single day, right? And
Yeah,
I don't feel so bad, but this time, yeah,
you
I
felt bad this time.
yeah.
Yeah, maybe due to winter, to your I don't know, maybe to the cold weather and everything is
Yes.
something that adds your bad feeling.
Yes, and this time I said no, I have to go to the doctor, and he gave me some medication and
Mhm.
everything, but I felt better after
Oh,
that.
no, yeah. That's good. You know, it's a virus, so our immune system must get rid of it. So that's why I do not suggest unless I mean unless you're feeling so bad as you were,
Mhm.
like just handle it at home.
Yes, that's right. But I still have a little cough. I don't even cough in that time, but I have a little cough now.
Oh,
And
really?
yes, I think it happened something with my lungs.
I don't think so. Maybe due to the weather is really dry in winter too, so that's something
Maybe
that also happens. You may try maybe I don't know some vapor and that kind of treatment.
eucalypt
Yeah,
vapors. Yes.
manzanilla
Or
too is good.
yeah, yeah, I'm doing that.
Okay,
Okay, thank.
perfect.
And I was talking with Rina,
Mhm.
and she told me that in her country, they are giving some kits to people that are sick with ivermectin. What do you
Mhm.
think about that? Do you think it works?
I'm not pretty sure, but I take it. You know, my father is a physician too, so he asked all the family to take it because it has some mm, like science background. There's some studies that have been made, and they say that it works. So, as it doesn't hurt you if you take it, why not? You know, you're not taking a risk. So, we take it like every 20,
Remo-
30 days. Yeah, actually, more frequently than it's needed. Bad. I don't know because I think we even with ivermectin we had COVID. Actually, I did maybe, and my mom now is sick too. So maybe she's passing through COVID right now too.
Oh,
Yeah,
but she's well.
yeah, she's like I was like a little bit of weakness, general muscle pain,
Yeah.
coughing, you know. But I don't know. I felt like bad for only 1 day or 2 days. Then I felt better.
Yes, the same me. Okay. Thank you, Jorge. Well, now I want you to choose maybe one mental illness and describe it for me. And if you
Okay.
want, no, you're not an specialist, but if you want, you can suggest any treatment. Okay.
Okay. Let's talk about something common. Maybe attention deficit hyperactive disorder.
Okay.
It's something really common. Today I had an experience with that. I'm taking it like a kind of webinar from the US in the mornings. And there was a nice story about a physician, about a neurosurgeon who had this disease. So this disease is um, like onset before 12 years old, is more often in children because it's something that we realize when people are young. It can be also um, diagnosed before I mean after 4 years old, and it is basically like impulsivity, hyperactivity, as his name says. Also, lack of attention. It is often expressed, with school or maybe some worship stuff, and it must be treated because it persists. If it's not treated, it persists well adult life. But it's something that doesn't affect the intelligence of the person. It's just like person is too distracted. So, but it must be treated, and the treatment is based on, I think, alpha 2 agonists, like clonidine. And well, coming back to the story of this physician, yeah, he used to have bad scores. He used to be really distracted. He used to imagine stuff while someone was speaking to him, and then he didn't know what to do with his life, and he joined the army, and he wasn't glad with that. But then he just like took an opportunity to go to med school, and he was really scared. And he also told us that he called his mom and told her that everyone was really smart but him, and he was really like worried about it, that he couldn't make it. But once a professor told him that he should be a barber, and that encouraged him to become better student. And he was the third of the third from his class, and he became a neurosurgeon. So he told us that nothing can stop you to chase your dreams, not even this kind of diseases. And just you need to focus and to have a motivation to get whatever you want to be. And yeah, that was a nice story. That's why I'm taking this opportunity to tell this story. And yeah, mental illness are they have a treatment, I think. Not all of them with good ends, but in this case, this is something common: the hyperactivity and lack of attention stuff. um and it's something that I think years ago they didn't diagnose this. It's something that is becoming like more common nowadays.
Yes, that's right. That's such a good story. I
Yeah,
like
that's
it.
my story. Oh, thank you.
Okay. And the last thing, can you name one tendon reflex and explain it to me?
Oh, 10 reflex. Okay. Let's talk about maybe patellar reflex. That is examined on the knee. Something important, something that you must examine always, because it's information for in general muscle activity. I mean, it's a reflex. So some people that have, for example, cortical problems or brain strokes, it might be an important, how can I say, an important feature that you should check about. So you just like, they taught us to do like just one punch, let's say. And so you can also, the legs must be like they don't to be hard, it must be like flat. And also the patient must not be like focus on his or her legs. You have to distract them. I sometimes when the muscles are like too contracted, when I do this test, I ask the patients to grab both hands and pull, so they are focused on their hands and do not think about their patellar knee reflex.
Okay, I didn't know that. That's good.
Okay.
And do you know any cases where the patient doesn't feel anything at all and they have no reflex?
Yeah, it sometimes happens with, for example, Guillain-Barré disease, because at the beginning, because this is a demyelinating neuropathy that climbs from, is symmetric and climbs from the legs to the whole body, and it's almost it's really dangerous because it can lead to death.
Wow. Okay, Jorge, thank you so much.
Oh,
Have
thank you.
you seen my, oh, yes.
Oh yeah, it's done. Yeah.
Okay, thank you. Oh my God, what happened? We have 3 people here.
Yeah.
Okay, just one picture and I'll let you go.
Okay.
Okay, see you tomorrow.
Okay.
Sorry, I'm sorry. Yeah. 3 o'clock, please.
Perfect.
We already, yes, yesterday we have our practical class with you.
Yes,
right?
yes. Or
Okay.
reschedule. Perfect.
Thank you so much.
Thank you.
See you
Good
tomorrow.
night.
Good
See you
night.
tomorrow.
Jethro. Good evening.
Hi, teacher. Good evening.
Hi, how are you? Are you good?
Yes, yes, teacher. I'm good. And you?
Okay, that's good. Have you heard that COVID is increasing?
Yep. Yesterday, I went to my hospital where I do my internship.
Yeah.
And cases of COVID is a lot. With the personnel, health, the doctors, the nurses, it's increases a lot, and the patients too.
Wow. Okay, you have to be careful and take care. Okay.
Yes, teacher. You too.
Yes, I got COVID 3 weeks ago, so I think I have a little time of resistance. But yeah, I'm taking care of myself because I don't want to feel again like that. It was bad this time. It was hard.
Oh, this year? 3 years, 3 weeks ago? Or I don't know. Sure.
3 weeks ago. Yeah,
Oh,
it was a little bad, but now I feel better and it's good. Okay, so how is the management of COVID in our country, in your opinion?
oh, in my opinion,
Yeah.
I think we need to do more campaigns and and talk, talks.
Or maybe you want to describe the management in our country and then give your opinion?
Okay, the manage is I think maybe the first that I can do is treatment like corticoides. Suppose it's corticoides.
Corticoides, okay.
Corticoides, antibiotics. I think
Antibiotics.
if this is necessary, because if it is not, it's one causa resistencia. It's not resistencia.
Resistance.
Resistance of the antibiotics, and that's not good.
Antibiotics.
Antibiotics, sorry. And this one, I think this with the corticoids is the it's the principal treatment of this disease, because it causes inflammation. I don't know how to say inflammation, right? Inflammation.
Inflammation.
Exactly, inflammation of the body. And
Just one thing. Corticosteroids.
that's
That's how we call it. Okay. Corticosteroids.
and I think this is one of the more important. Corticosteroids is the principal manage of this disease.
Okay. Do you think doctors or have you seen doctors giving medication to the patients like ivermectin?
Yes,
Yes. What do you think about that? Is that okay? No?
in my opinion, in my personal opinion, I think this is no good, because I think last year I lose my uncle for COVID, and he
Oh.
took a lot to like drink ivermectin. It's good. You can save your life with this with you drink this thing, and it's a lot, and he died in USA, not here. In USA, he lives uh, in California, and he died. In another personal opinion, I have one patient in COVID area. I attend this patient with I don't know how to say encomiendas, dejan encomiendas en el hospital.
Let me check this. Okay.
Okay, and this I don't know, the family of the patient, they left food, drinks, or something like that who can eat in the hospital. Okay, and and this patient, her family leaves her ivermectin, but we don't know, we don't see. It's like, and this patient, after the visita médica, se me fue.
Medic appointment.
Medical appointment, left the medical appointment, he drink, and the nurses and the doctors, nobody see. And after, I think this patient died. Okay,
Wow.
I think 3 days ago or 1 week. I don't know. I'm not sure. We the nurses see the ivermectin, and se me fue, debajo de la cama, se me fue.
Under the bed.
Under the bed, ivermectin, and the patient died.
Wow. I cannot believe it. Okay. I don't know if you can see the chat.
Yes, teacher.
Parcels, encomiendas.
Oh, parcels. I don't know this word. Okay. Thank you.
Okay. Yes, I didn't know about it until now. Okay. Well, okay. Thank you for sharing your story with me, Jethro. And now we're going to talk about mental illness. I don't know if you can choose one mental illness and describe it to me. Okay.
Can you repeat?
Yes, mental illness. Choose one and describe it to me. I know you're not a specialist, but you can give me some treatments if you want.
Okay. Maybe like we see in the classes yesterday, in the class yesterday, it's loss of consciousness, right? Loss of consciousness or
Yes,
symptom.
but this is a symptom, right?
Yeah.
Or a sign
Yes, I
that
think.
it's a sign. But yeah, I want you to describe a mental illness.
Oh, okay. You're talking about I think depression, right?
Yes, if you want.
Okay. I think this one is more common not just in Bolivia, I think in all the world.
Okay.
Well, this disease is the most common in the population, not just in Bolivia, not just in all the world, and is the this is common that the people don't go to the doctor, don't go to I don't know,
Psychiatrist.
psychiatrists. They don't go to the psychiatrists or psychologists.
Mhm.
I think this is not common in here in Bolivia, but I think this disease is very dangerous for mental with estado mental, se me fue el dicho.
Mental state.
Mental state of the person. I think this is cause a lot of damage on the person.
Or state of mind. Remember the song
What I know, I don't know.
State of Mind? Okay.
And
Okay, continue.
okay, like I said, people don't go to the doctors or they don't accept this condition. They don't accept have they have depression, and this is the more this is and this is the mistake with
Mhm.
people have it don't accept it.
Okay, they don't accept and they don't know, maybe, no? They don't know that they even have it.
I think, in my personal opinion, I I think the person or the patient, or she knows I have depression, but they don't want to accept it. I This is my personal opinion because, like can say in the class of just in the yesterday class,
Mhm.
I think all of all of us have depression in one time of your life or
Yeah.
in common, but we know, but we don't want to accept this condition. And I think this is the more dangerous and cause a lot of cause a lot of pain and affect a lot in our lives.
Okay, that's right. Thank you, Jethro. I don't know if you can see my questionnaire.
Yes, teacher, I can see. Yes.
Please, while I ask you the last question, can you mention one tendon reflex and describe it for me?
Okay, I think we see this and yesterday, right? I think one is the Babinski, right?
Yeah.
And
Okay, go ahead.
okay, this proof can do in the foot and with a pencil or with a pen, you can, I don't know how to say, how to explain. You can not touch, como rozar, se llama, como
Hit or punch?
no, I don't think it's like solo rozarlo, solo hacer este movimiento.
Okay.
Como
Let me check.
touch all the,
Touch softly the area.
yeah, touch softly of the area of the foot. And if we have, when we do this reflex, if there is a extension of the foot, it's negative. This proof is negative, and it's a flexion, right? Of the, it's the same fingers, right? Fingers of the foot, it's the same.
Yes.
And if that a flexion of the fingers, like that is a positive proof.
Okay. Okay, Jethro, that's good. Thank you so much. And okay, we had yesterday's practice class too, right?
Yes, teacher.
Okay, so tomorrow we will see you at the theoretical class at 8, okay?
Okay, teacher.
Okay, thank you so much. Have a great night.
Okay, you too, teacher. Bye. Have a good
Bye.
night.
You too. Bye-bye. Hi, Ale. Good evening.
Hi, teacher. Good evening.
How are you?
Fine. Thank you, teacher. And you?
I'm fine, thank you. Have you heard about the increasing cases of COVID in our country?
About
About COVID cases in our country, the increasing. Have you heard about that?
complications?
No, COVID.
New cases?
Yes, the increasing of cases in our country. Have you heard about that?
I'm not enough. I don't have enough information, but yeah, the cases are
Ascending?
As exactly, ascending.
Okay. Do you know? Of course, you know. I want you to explain to me the management of COVID in our country, please.
Okay. We have levels for COVID. Okay. And the first level is not complex. It's like a flu. It's similar to a flu. The patients have a headache, have flu, I don't know, fatigue. And the treatment in these patients are symptomatic, like paracetamol or ibuprofen, a lot of water, repose. Yeah, and I don't know how you can say aislamiento.
Isolate. Let me check that. Okay. What else?
That's first, in the first level.
Okay.
In a second level to the COVID, we need a radiography because we need to see if the lumps have complications.
Okay. That's the word, isolation, like we were saying.
Isolation. Okay.
Mhm.
Thank you, teacher.
Yeah.
Okay. If the patient has, I don't know, pneumonia,
Pneumonia.
pneumonitis,
Pneumonia.
pneumonia. We have to see the oxygen of the patient. If have a good level of oxygen, we have the option that the patient have the treatment in her or his house. But if the patient need oxygen and maybe need internation. And
Okay.
in this patient will we need antibiotics.
Antibiotics. Mhm.
Anti-inflammatories. Anti-inflammatories.
Inflammatories.
And sometimes we need anticoagulation medicine.
Okay.
And the third part of, or the third COVID
Stage.
stage of COVID, maybe we need a special location like intensive care.
Okay.
Because these patients will have really hard complications and need intubation for have a correctly level or balance of oxygen. And it's difficult, the treatment in these patients.
In an advanced case, right?
Sorry?
In an advanced case.
Yes.
Okay. Okay, thank you, Ale. And I was speaking with Rina, and she's from El Salvador, so she told me that in her country, people were a health minister were giving kids with ivermectin. What do you think about that? It is usual to do that, or it's not working at all?
When the pandemic start, we use ivermectin in kids. I don't know if you listen about megazastriliaje.
Yeah, I heard about it.
In this occasion, we give a kit with ivermectin, ibuprofen, omeprazole, and other medicines. But now the article says that it's not correct and not help really in these patients. But I talk with some doctors and they say, yes, the ivermectin is helpful.
Okay.
And
did you take it?
No, I never take it, but all my family, yes, take it.
And what was the consequences? Or it was everything?
Not really, because it's for parasites.
Okay.
We use the ivermectin for some parasites.
Okay, for parasites, of course, that's
Okay.
the function.
And if you take it, you te vas a desparasitar.
Okay, you deparasitate.
Okay, desparasitate. But no,
Nothing else.
if you take a lot of ivermectin, you maybe have a toxicity clinic, and that's not good. And for other things, no, not really. It's not really bad.
Okay. Just one thing, the correct word, it wasn't the parasitation. Like I said, it was the worm. The worm.
Desparasitation is for worm.
Not correct, yeah. The worm. I said to you,
The worm.
worm. Okay.
Okay.
I wasn't sure about that, so I look it for. Okay, perfect. Thank you so much for the information, Ale. And I want you to choose one mental illness and describe it to me. And if you want, of course, you can give me the treatment. I know you're not the specialist, but you can give me suggestions, okay?
Okay. Maybe I don't know, the pronunciation is correct. Anxiety?
Anxiety.
Anxiety.
Yeah.
Okay. This is a very, very common. I don't know. Yeah, I'm not sure it's a mental illness in all the word extension, but it's a psychiatric problem.
Okay.
Okay. These patients I see them have crisis sometimes. And these crises have palpitations, and you can hear the beats of the heart. Have a fatigue. Sudoración. I don't remember the word.
Sweaty.
Sweating. Okay. Yes. Sometimes can breathe. That's really, really hard because in this crisis, because in comparison, like other mental illness is frequent.
Okay.
And I see my best friend have anxiety, and sometimes she cry when we are on the street and have that palpitations. I can hear that. She can breathe.
Okay.
I'm not sure about the treatment about this patient. Sometimes they need medication, sometimes they don't need. In other kinds of mental illness, yes, they need medications. But this is depend.
But what will be the treatment or the management?
Okay, first, I see that you have to work in the things that develop the anxiety. Maybe I don't know, when you talk with a lot of people, like a special event, or I don't know, you have to talk or do something specific, something.
Okay, that's perfect. And the one last thing, just while have you seen my questionnaire?
Yes, yes, teacher.
While you're answering, I just want you to choose a tendon reflex that you can describe it to me?
Reflex. Can you repeat?
Tendon reflexes. Remember we were talking about yesterday?
Okay. Yes.
Pick one and describe it to me, please.
Tendon reflex, like the classic tibia reflection. The patient have to stay in sit.
Okay.
With the pie cruzar. ¿Cómo se dice? Cruzar.
Feet cross.
Okay, feet cross. And with a special hammer, we put the hammer in the oh my god, I don't remember. Debajo de la rodilla.
Under the knee. With the hammer under the knee.
Okay. Under the knee.
Getting nervous, I know.
And the normal reflex is extension of the leg.
Okay. So do you know any case where some patients doesn't feel anything at all or doesn't react?
In my cases, no. All have a good reflex. Oh, maybe, yes. With patients that have accident, horrible accident, and are in coma. In these cases.
Yeah. Okay, I get it. Okay. Ale, that was good. Don't get nervous, Ale. It's just me.
Yes.
No.
The problem is me. Sometimes I don't remember some words and I put nervous, and that's not good for me.
It doesn't have to be a problem, okay? Try to speak out loud in front of a mirror.
Okay.
Try it. Okay, and find out that words will come sealed. Okay?
Okay, thank you, teacher.
Here, see you tomorrow. And I don't know. No, yesterday we have our practical class, right?
Yes.
Okay, so see you tomorrow at our theoretical class. Take care.
Okay,
have a good
bye. Have a good night.
Hi, Carlita. Good evening.
Good evening, ma'am.
How are you? Okay, here we are. How are you?
Well, I feel a little tired.
Okay, have you worked a lot?
No, well, I am doing my, how can I say, trámites?
Okay, you're preparing your documents?
Yeah, preparing my documents to be able to have the grade will be
the title?
Grade quizzes.
Oh, okay.
Yes, right. Because I just finally the internship about 2 weeks ago, so I have to do my documents, to prepare my documents.
Okay, I know you're tired. Okay, let's finish with this.
Okay.
Have you heard about the increasing cases of COVID in the country? So, what do you think it's the management, or can you describe management of COVID in Bolivia?
Well, here in Bolivia, specifically in Cochabamba, this is management by sedes, and sedes is doing many free tests, like antígeno nasal and PCR, in many places.
Yeah.
And these are free, so it's positive cases. I think it is good because those are free. But for example, when I was in the rural, the cities used to say that we have to do this test, and people didn't want to do the test. They practically we had to rogarnos, rogar. How
To
can I say
beg
that?
them. You have to beg them. Yes, beg.
Okay.
Them.
Yes, because they didn't want it. They want, I know, and we have to be which is the conscientes.
Conscious. They are not conscious.
Yes, and they PCR is a test expensive, and it was free. I don't know how people think about that. So that with tests, and also a SUS program. There are program for COVID-19 that we can download, descargar. Excuse me, miss?
Download
medicaments for free, drugs for free.
Download medications for free. Medication for free.
Yeah, we can download medication for free, and I think that's good for people. But obviously, it not download all the medicaments we need. But I think it's a good option.
Yeah.
To keep people in calmados,
to keep calm.
To keep calm people. I think that. And but we have to be conscious that it's a virus sickness, so we don't have to medicate antibiotics or another drugs just like, I don't know, como sea, o sea, for, I think that.
Okay. Hey, thank you so much. And what do you think about the ivermectin? Do you think it works or no? You're against?
In fact, ivermectin, is that correct in English, right? Yeah, it's one of the drugs that the program of COVID-19 we can download with that program. Yes, the gobierno, how can I say that?
Government.
The government equipa. How can I say equipar?
What do you want to say?
Equipa con estos medicamentos.
Okay, you can say the government. I don't know how to say it. Give us those choices of medication to work with.
Yeah, give us, but and that because these are free, doctors have to download this ivermectin. Also, they don't want to use this drug, but they don't want to because they have to use this ivermectin. In my personal opinion, I don't think that it's useful because there is scientific evidence that these don't work in us. So because it says that we need high doses.
Yes.
doses. Is that correct?
Doses.
Yeah. How high doses to be effective against the COVID-19, and these doses are are incompatible with the human. So we are practically we have the ivermectin like a placebo effect will be.
Yes.
Yes, that maintain people calm.
In English,
Maybe that
placebo, what did you say? Placebo effect.
effect.
Yes.
And it
The-
can be.
Okay, continue, sorry.
You know, it could calm people, maintain calm, people calm. I think that. So because in low doses, at least until now, there are and there weren't. No, there isn't. There wasn't. There
There
weren't.
were, yes.
But bad effects. I think that so we have to maintain people can. I think that can. Sorry.
Okay, that's good. I
Mhm.
understand your point.
Mhm.
And what do you think? Well, no, talking about yesterday's class. Let's choose one mental illness and describe it to me. I know you're not a specialist, but if you want to make any suggestions of management or treatment of this illness, you can make it, okay?
Okay. Well, when I took the psychiatric materia in the university, right? I am one of the sickness that
Subject.
sorry.
Instead of materia, is subject.
Okay, thank you. Subject psychiatric. One of the sickness that called me my attention. Is that correct? It was I don't know how to say in English. Trastorno de identidad disociativa.
Okay, it can be identity disorder. No, dissociative disorder.
Identity dissociative disorder, right? Yes. Before it was called trastorno de personalidad múltiple.
Okay, let me check that just to confirm.
Okay, thank you, Miss. It was called before that, but now it's trastorno de identidad disociativa. I don't remember much about this, but what I remember is that it is characterized by the existence of two or more identities in one person, and those can be and the person can be conscious of that she or he has other identities, and also they would not be conscious.
Okay.
I don't remember so much about the sickness, but this one was
they are not.
Sorry?
They are not conscious about what they are doing or thinking?
It depends. Will be both, but will be both, because there is also there are many movies about that.
Yeah.
Yes. So, Miss, how can I say es el que me llamó la atención? I'm not sure about that. How needed my attention?
Yes, the one thing that get my attention was.
Okay, sorry. Good. I think that, but I don't remember much about this.
Okay, no worries. But what do you think it should be the management?
Well, it will be psychotherapy.
Psychotherapy.
Psychotherapy, and I don't remember the other. I don't remember the name. Maybe to maintain calm the patient would have we can use some drugs, but if the one of the identities is aggressive, yeah, we can use this drug, but we have to study the patient, I think, in this case.
Maybe have more sessions with the patient, right?
Yes.
Okay. Perfect. Have you seen my questionnaire?
Yes, it's here.
Okay. I will take a picture while you send me the answer.
Okay.
Okay, thank you. Okay, Carlita. Well, see you tomorrow then. We already have our practical class yesterday,
Yes.
right?
Yes.
Okay, so tomorrow we will just have the theoretical class, okay?
Thank you. See you tomorrow.
See you tomorrow. Take care and get rest.
Thank you, Miss.
Bye-bye.
Good evening, teacher. Creo que...
Hi, Valerie.
Hi, how are you?
Sorry, I cannot listen to you. I take off my headphones. Okay. Now I can. Hard.
Hi.
Okay, vale. Well, have you heard about increasing cases of COVID these days?
Me, no. Sincerely, I don't listen in the news, and I don't watch the news either.
Okay,
Because I really get angry about some things. So I decide not to watch, but I heard about it, that the cases are but the cases are increasing.
Increasing.
Yeah, so I think we are like getting to the fourth
Five.
or fifth ola. Yes. And it's something that everybody knows that one day it will come. So we are just waiting to, but also taking care about, no? So always have your disinfectate, your alcohol, use your mask, try not to be in places that are closed. Wash your hands all the time. So also have your hands cream, because when you are washing all the time your hands are getting really ugly.
Yeah.
Like they are really hard, and I don't like. So always wash your hands and put some cream and then your alcohol. Yeah.
A good advice.
Yes. So
Okay.
yes, I think also with the vaccinates, I think the COVID it's not less, but I think the symptoms that you can catch are not so heavy than when we are in the first thing. For example, my cousin get COVID 3 weeks ago. So no, 1 month ago, sorry. And only the first day she feels really bad. She had a headache, a stomach ache, and problems with the feces, but only the first day. Then all the week it was really, really chill. Like she was really relaxed. Also, I think it's really important to take a drink a lot of water.
Drink a lot of
Yeah,
water.
yeah, yes. And my aunt, she's really crazy because she heard, yeah, when the COVID start, she heard like vitamin C, it's good. So she went to the pharmacy and bought
Both. Yeah, both.
all the vitamin C that she can.
Wow.
Then she heard, I don't know, something is good. So she ran to the pharmacy and bought all. Yeah, I'm like, I don't like to drink drugs, but no, I don't like. I'm the person that it's only with natural things or sleeping, I will get better.
Yeah.
So I was like, Mom, no, please, no, don't. Because when you drink a lot of pills, you are damaging your liver and your kidney. So I'm like, I prefer not. But she was really cool. Also, she has the two vaccinates. And she was, yeah, 2 vaccines. And she was really, really, really relaxed.
Okay, that's good. Actually, I was about to asking you, what is the management in Bolivia? But you already told me the most part of that, I think. I don't know if you got a protocol or something like that.
For example, I'm the person that says, okay, you have headache. Okay, maybe we can start with paracetamol.
like the 500 milligram. It depends. If the headache is really, it's painful, you can drink like every 8 hours. But if it's not so painful, like only 2 times in the day.
Okay.
But only for 3-5 days, not all the week or all the 2 weeks that the person is like close in his or her bedroom.
Okay.
And then you can drink antigripal like Tapsin or antigripal leche. I prefer Typirex. I love the Typirex. So I drink only 2 Typirex in the day, but also only for 3 or 4 days.
It works.
Yeah,
Does it
for
work?
me, it really works. Yeah. For me, yes. For example, when I got the COVID, when I catch the COVID, I only drink Typirex with ibuprofeno. Ibuprofeno of 600 milligrams, but it was strong. So I drink 2 times per day, only for 5 days. And not only with that.
Okay.
But my mother bought the you know that Ceres put like a healthy pack with all the vitamins, like says antigripal, 7 days, 3 times per day.
That's why I was asking you.
Paracetamol. Yeah, it depends. For example, if my mom
Even
says,
ivermectin.
yeah, I read about. I never heard that it's like worse or that has some risk. So I told my family, okay, let's take it.
Let's try it.
I also take it. Yeah, because where I read is that it's antiparasitario. So the only thing that it will do is that helps to clean your intestine. So I think it's good. So I say, okay, let's try, but we only take like 1 pill for 30 kilograms of weight. So if you take the pills today, the second take it is like 21 days after, and only with that. Not like, because I heard that a lot of people are antiparasitic. Okay. A lot of people drinks like 1 pill or 2 pills like 15 days. Like today, 15 days after, then 15 days after, and 15 days after. But
I don't that I heard it was 1 pill of 6 milligrams. Right, of the person, and maybe for a person who is on 50 kilograms, maybe need to take, I don't know how was the formula, but it was
I think it was 1 pill per 30 kilos of weight. And if you only can take 3 pills, no more. No matter how much is your weight, only 3.
Okay, that's good.
Yeah, but I think it depends. If you are a person that you like taking or drinking pills, and because I think, okay, the pill can help, but everything is in your mind. In your mind, everything is in your mind. So if you think that if you're drinking a lot of pills, it would help, okay, I can give you a lot of pills. It's not
but
a
it
problem.
can cause you.
I know. That's why, for example, my cousins they ask me, Vale, we are like this, what can we take? So I love Typirex with ibuprofeno for the cause. I think for the coke, because I think it's the best treatment that you can use. It helped for me, and with all my family work. So for me, it's okay. But for example, my mother, she's crazy and she's like, no, only with that, only with 2 pills. So I say, okay, you can drink a lot of pills if you want. So I gave her like 5 or 4 pills, like ibuprofen, vitamin C, and antigrippal, paracetamol, and also the ivermectin that it comes like with the 5 pills. So she was like, okay, I'm good.
Like a placebo effect.
Exactly.
And maybe you should have gave her just candies instead of.
No. She knows a lot about medicine. When she was young, she wants to be a doctor, but she couldn't. So she know about a lot of about medicines and about medicine, like the career. So no, I can't like
You
I don't
anything else.
exactly. So I will say, okay, let's drink all these pills.
Okay, vale. Talking about yesterday's class, remember that we were talking about mental illness. Could you choose one and describe it to me? Maybe you can give some suggestions for treatment. I know you're not a specialist, but you can suggest.
Okay, talking about mental
The
illness.
management.
Okay, I think maybe we can talk about anxiety.
Okay,
because
anxiety.
Okay, anxiety. Because I think it's really common. All that person has a percentage of anxiety. I think everybody in a moment of our lives, like pass with this. You can say that symptoms of this illness is when your brain is working like 200% at the time, like you are thinking, overthinking about anything. Maybe also it can come with a muscle tension. Maybe in some case it can be with the problems with your appetite, like it can
appetite
sorry, appetite. It can increase, or you can have more appetite or less appetite. I saw some cases, but you can have problem with this. You can have you can also have fatigue. In some cases it can have chest pain. But I think the most important, it can come with the stress. Everybody has stress, but this person like duplicate the stress, or duplicate, like they are overthinking the things. And in some cases, the person can think that he's in a worry situation, or that the life is in some worry, or it can happen something really bad. And I think that also the person can have a lot of the person can sleep a lot, like I don't know how to say, increase of the hours of sleep.
Insomnia?
Yeah, it can also have insomnia, like the person can't sleep, or it can sleep a lot, like the person wants to sleep all the time in the day.
Okay, tiredness.
Yeah,
or
exactly.
Insomnia.
Yeah, tiredness. I think it's more tiredness. And also, I think also I heard, but I don't remember so well, but I think there's a lot of types of anxiety. It's not only one type, but the most common things is that the person in one time of the life, it can have like a panic attack.
Wow.
Like, yeah. I saw a friend that oh, he told me because he lived like 2 panic attacks in his life, and when we are together, he was sweating, and he was like hyperventilating, like he was
Okay.
breathing so fast, and I was
Mhm.
like, "Are you okay?" And he only saw me and told me, "I think I'm having an attack," and I was like, "Oh my god, I don't know what to do," and I gave him a bag, plastic bag,
Mhm.
and he started like
Inhale and exhale.
inhale and exhale in the place, and I was only doing calm, keep calm, and I hugged him, and
Mhm.
he started like breathing slower, and yeah,
Mhm.
he didn't have a panic attack in that moment, but he told me about his panic attack, and it was starting like that, like he started hyperventilating,
Mhm.
and like stop anything that he's doing, and only start, and then the chest pain come, and the only thing that he can think is like, I can't breathe, I can't breathe,
Wow.
I'm dying. So he told me that you can say that the brain part in two. So one part of his brain's telling him like, you are okay. No, it doesn't. How do you say? Everything is okay. You're safe. But the other
You're
part of
safe.
yeah, exactly. You're safe. Like it will come. It will nothing happen. And the other part of his brain is like telling him, you are going to die. You are going to die. So the only
Wow.
thing that he said is like, I can't breathe. I can't breathe. He told me that in that moment he was with his cousin. So his cousin is like moving him because he was the driver in that moment. Moved to the other seat, and he go to the hospital. And the only thing that he need it was oxygen,
O-
oxygen,
Oxygen.
oxygen, oxygen. So the tachycardia at the faster respiration calm, and he was really good.
Wow.
Yeah,
Thank
yeah,
you for sharing the story with me. That was a little bit interesting because he was struggling with his mind, right?
yeah. Because one part of of his mind it telling him like everything is okay,
Mhm. Yes.
and also it. He told me that he knows that he was having a panic attack. Like
Wow.
he knows that it was okay everything, but the other party was like, I can't breathe, I'm dying, I can do this, I can.
Oh, poor guy. Well, we
Yeah,
have
yeah,
to be careful with that. Okay, but I think
yeah,
you make a good control of the in that situation.
yeah. I was
So
like,
that was
everything's
good.
calm, hugging him,
Mm.
like controlling his breath. I was breathing with him, like inhalate, exhalate,
Inhale, inhale,
inhale. Okay, okay. Sorry, inhale, exhale.
exhale.
And I was moving my hand like 1, 2, 1.
Well,
I was really nervous.
it will
Yeah.
it will help you to remember to inhale, exhale.
Inhale, exhale. Yeah.
Yeah.
So
Hey, Vale. Thank you so much. It
no, thank
was
you to you.
really good. Tomorrow, remember we have yes,
9:45.
yes, 9:45. It would be your practical class, okay? The replacement, and of course at 8 we have the
Normal
theoretical
class.
class.
Yeah. Yeah,
Yes.
yeah, yeah.
Okay.
I know, teacher. Yes. See you tomorrow. Thank you.
Tomorrow. Take care. Bye bye.
You
Have a
also.
great night.
Goodbye.
Bye bye.
Hi, Jocelyn.
Hi, teacher.
Good night.
Good night, teacher.
Okay. Could you please turn on your camera?
Okay, teacher.
Thank you so much. And have you heard about the increasing COVID cases?
Um, the COVID, teacher.
Yes, COVID cases are increasing. Have you heard about that?
¿Cómo, teacher? No lo entendí.
Have you heard about that? ¿Has escuchado de del incremento de los casos de COVID?
Yes, teacher.
Okay. And would you explain to me what is the management of COVID in our country?
Mm,
Do you understand?
okay, teacher. Sería el acitromicina, directamente el tratamiento de teacher.
The management. I don't know what is the management specifically for you, maybe on your healthcare center is different. I don't know if we manage the same way in every single care center. But you can tell me in general, what is the management?
Ya, the tratamiento is
The treatment.
the treatment is centro de tratamiento centro de salud, ¿cómo se dice?
Healthcare center.
Health center via
Healthcare center. Repeat after me.
health center.
Exactly. Okay.
Health center via Rivero is acitromicina para paracetamol. Abifavir.
Okay.
Abifavir. Enoxaparina.
Okay. Anticoagulant.
Anticoagulant, enoxaparina. Remdesivir.
Okay.
Después, ¿qué más? A ver, a ver, ya. Corticosteroides.
Corticosteroids.
Corticosteroids. Menciono, ¿no? Prednisona.
Okay.
Prednisona. Después metilprednisolona.
Okay. Just one question. I don't think all your patients take the same treatment, right? Maybe in case they need it, just in case. Just in case they need it, right?
Solo en caso de necesitar, no creo que tomen todo eso, ¿verdad?
Sí. Depending in severity,
It depends on
is
the
depend
cases.
cases. Okay.
Mhm.
In the cases,
Okay. Do you use ivermectin?
no, teacher.
No? What do you think about that? What is your opinion about ivermectin?
The ivermectin is antiparasitic.
Okay.
Is
Let's
antiparasitic.
go to the chat. Antiparasitic.
Antiparasitic. Antiparasitic. No. Antiparasitic. It is no indication in the gears.
Okay, on the texts or on the guides?
Guys, like gears.
Guides.
Guys. Yes, guys.
Guides. Like that.
And yes.
Okay, so you don't use that, right? You don't reset to your patient. Oh, you don't make a recipe for your patient with that.
I not recipe.
Okay. I do not make a recipe.
I do not make a recipe.
Recipe?
Recipe.
With ivermectin. Okay.
With ivermectin.
Okay. And would you please choose one mental illness and describe it to me? Choose one and describe it to me.
It is the depression.
Okay.
It is depression. Cara. Sé cómo era.
It's
characterized by love, mount and feeling of on the sadness, symptoms of depression are falta, ¿cómo se dice, teacher?
What was the word?
Falta, ¿cómo puedo decir? Falta de apetito quiero decir, pero falta, ¿cómo se dice?
Lack.
Lack?
Lack of appetite.
Lack of appetite. Weight loss or loss weight. In insomnia,
Yeah.
em, em, pa, pa, fatigue,
Fatigue. Fatigue.
fatigue, em, fatigue, ese,
Ok. Jocelyn, ¿puedes llenar mi encuesta, por favor?
ok.
Y una cosa más. Jocelyn, necesito que veas los videos nuevamente, por favor, desde el principio, porque ya vamos a dar el examen final de este nivel. Necesito que practiques y pronuncies bien y entiendas bien lo que estás diciendo, ¿ya? Porque una cosa es leer y otra cosa es que tú me hables de lo que sabes, porque sabes medicina, ¿verdad? Solamente es decírmelo en inglés, pero tú no estás aprendiendo cuando lees, o sea, no estás agarrando es para el ratito, te vas a olvidar más tarde. Necesito que practiques, que vuelvas a ver. Puedes practicar con Weimar, le ayudarías bastante también. Él tiene el mismo detalle que tú. Creo que son compañeros, ¿verdad?
Ujú.
Entonces pueden ayudarse mutuamente, haciendo conversaciones, mejorando la pronunciación. Les va a ayudar muchísimo. Por favor, háganlo. Traten de buscar el tiempo. Ahora tienen también videollamadas, todo eso, y van a poder hacerlo. ¿Ya?
Ok, teacher.
Por favor, porque necesitamos, yo sé que ustedes van a poder, pero falta práctica. Tal vez no nos falta tiempo. Ese es el único problema.
Sí, sí.
Entonces tenemos que acelerar un poquito, ¿ya?
Ok, teacher.
Muy bien. Entonces nos vemos mañana en la clase práctica.
Mañana es de la clase 2, ¿no ve, teacher? La práctica.
No, mañana, mañana es, mañana la clase teórica a las 8 y a las 10 contigo en la clase práctica.
10
¿Ok?
de la noche. Ok, teacher.
Listo. Nos vemos.
Goodbye.
Chao, buenas noches. Hi, Sergio. How are you?
Hi, Miss Encinas. Very tired, but, but I'm here.
Thank you so much. Can I ask you to turn on your camera, please?
Yes, sure.
Okay, thank you so much. Okay, let's start to finish so fast. Okay. Well, have you heard about the COVID cases that are increasing in these days, right?
Yes, I heard of the cases in Santa Cruz. I'm
Okay.
not well informed about the cases all around Bolivia, but yes, in Santa Cruz, yes.
Okay, so they are increasing, I think, in all of the country. But I don't know exactly what is the management that you're using on your consultation or the place you are working on. So could you describe it to me?
Well, in my case, in my current job, we're not treating patients with COVID-19. My actual job, my current job is about treats. I mean, we don't treat actually patients with HIV, but we offer them different diagnosis tests that are free for them. But they're all patients. They're all inpatients from this hospital called San Juan de Dios. So yes, I don't exactly deal with COVID-19, with patients diagnosed with COVID-19. Yeah.
Okay, lucky for you. But do you know in general the management here in Bolivia?
Well, I can tell you what I know about the management in Hospital San Juan de Dios. I know that they enter or they get into the hospital or the ER, and depending on the patient's symptoms. Maybe if the patient has shortness of breath, if he or she is unstable, if hemodynamically is unstable, yes, they admit the patient or they accept the patient to be an inpatient. But otherwise, evaluating the case, they would have to decide whether to send the patient to his or her home or be in the hospital, yeah, as an inpatient.
Okay. And about the treatment, what is the medication?
About the treatment, it would depend. If it's a male case, what I know about, according to my experience and what I know the Bolivian protocol is using is, I guess, a symptomatic or supportive care in the male cases, such as anti-inflammatory drugs, uh, and mostly supportive care. But if it's a severe case, maybe the patient would be a candidate to be in intensive care. And obviously, more, stronger drugs would have to be used.
Okay. And have you ever used ivermectin?
No, I never. If I recommended the
Or
ivermectin,
use?
or if I took ivermectin as a patient. No, I never did, because I always wanted something that is secure and something that had evidence in the scientific field first before taking or recommending any medication. Yeah.
Okay, thank you. I love your answers. You have such a different answers, so it's so good to listen one to another. Okay.
Thank you so much. I'm glad you liked it.
Well, since
Sorry?
what did you say?
Oh no, I was saying that I'm glad that you liked them, and sorry for interrupting you.
No, no worries. Okay, since we were talking about mental illness yesterday, maybe you can choose one and describe it. I know you're not a specialist, but you can suggest any treatment or management of this condition.
No, okay. Well, what I remember about yesterday's class, and maybe the most common, maybe affection disorder would be depression. A disorder that is like I learned on yesterday's class is one of the most common disorders, if not the most common one. It affects everyone's lives, and related to the treatment, maybe depression first should be treated with some advice to the patient about his or her life, maybe suggesting or recommending him or her to seek help first. If the patient starts to have the symptoms that start to affect his or her everyday life, maybe if the depression is not that severe, it can be cured just with advice and with lifestyle changes. But if it's a more severe case, then maybe a psychiatrist would have to indicate or start some medication that is specific for treating depression, right?
Mhm. Okay, so you think there is a difference between just depression and major depression?
Yes, there is. There is a big difference because major depression symptoms will eventually start to affect the person's everyday life and his lifestyle.
Okay, and maybe it can end with suicide, right?
Yes.
Perfect. And the last question, and I let you rest. Okay, we were talking about tendon reflexes too. So you can pick up one and describe it to me.
I don't remember exactly. I know that tendon reflexes. I know which ones they are, but the exact name I don't remember right now. It's I know there's one on the knee, or I know there's these Achilles reflex tendon reflex. There's the bicipital, tricipital one. I know there's all of them, but there's this hammer you use for the knee reflex that you hit in a specific region
Mhm.
that has to be or is in the area of this tendon on the knee, and that causes the leg to kick. So that would be one of the tendon reflexes.
Mhm. Okay, the patellar reflex, I think.
Oh, that one was that when when you have to touch like is it called the plantar reflex
Yes.
with the sole, right? When you touch with maybe a stick, or maybe even the hammer you use, the part of where you handle the hammer, you can use the end of the hammer to like touch. I don't know if gently, but you can touch the plantar area of the feet, and the normal reflex would be that the fingers um go. How can I explain it in words? Uh, but that the word that
It may
the
contract
fingers flex.
or make a
Sorry.
contraction.
Yeah, that normal reflex would be that the fingers flex inwards. Maybe I don't know if I can explain myself correctly. And what would be pathological or an alteration would be that uh, that once you touch the plantar area, fingers extend. And that would be the Babinski sign.
Mhm. Okay,
Yeah.
perfect. And in the first case, you were telling me on the knees, is there any case where patients doesn't have the reflex?
Yes. Mainly neurological disorders or alterations will affect these reflexes. They can be diminished, absent. Uh, I don't remember exactly the term for it when the reflex is increased, uh, or when it overreacts. There isn't a specific term. I'm trying to remember.
Okay, no worries. But it was a good explanation. And I will send to you my questionnaire. I don't know if you can see it. Maybe now.
Yes, I can see it.
Okay, could you fill it for me, please? And tomorrow, remember we have a practical class after the theoretical class at 10:15 with you.
Okay, then tomorrow the class is from 9 to 10 and from 10 to 10:15, right?
No, it's from 8 to 9.
Oh,
And
okay.
then with you at 10:15.
Okay, perfect. Is there a chance if I can start the practical class before or
Or
the-
okay, we can switch places. Maybe I can speak with some of your classmates and I will tell you tomorrow. Is it okay at 9?
yes, please, please, please.
Sorry, I will take a picture. Okay, one more.
Okay, no problem.
Hard. Okay. Okay, I will give you the confirmation. I will speak with your classmate, okay? And I'll
Yes,
tell you,
please. Sorry?
and I'll tell you tomorrow.
Okay. Yes, please, because I'm having classes all day, like
Mhm.
from 8 a.m. to 5 p.m. and I get to the hotel I'm staying and then I have more classes at night. So I'm
Okay.
very exhausted. So please, if there's the option, I would love it.
Okay, no worries. I will do my best. I'll tell you tomorrow.
Thank you, Miss Encina. See you tomorrow then.
See you tomorrow. Have a great night. Bye-bye.
Thank you. Bye. Good night.
Hi, Weimar. Good night.
Good night, teacher.
Weimar, ante todo, mis condolencias. Espero que estés mejor. Todo va a pasar. Siempre hay que aferrarse a Diosito, ¿ya?
Thank you, teacher.
Okay, let's start this. Well, have you heard about the increasing of cases talking about COVID Do you understand the question?
Sobre COVID, teacher.
Yes. Could you explain to me the management of COVID in Bolivia?
Okay, teacher. Em, mm, definition.
Mira, te pregunté si podías explicarme el manejo de COVID en Bolivia. O
Okay,
sea,
teacher. At the hospital, treatment is anticoagulation,
coagulants.
anticoagulants, enoxaparin, heparin sodicon.
Okay.
Uh,
You can tell me in general if you want, like anticoagulants, then we use antibiotics, for example. Then we use, do you understand?
Okay. Yes, teacher. Antivirals. Tenemos Remdesivir.
Okay.
Corticosteroides.
Corticosteroids.
Corticosteroides. Hidrocortisona. Prednisona. Prednisone. Metilprednisone.
Metilprednisone.
Metilprednisone. Antifever, fever.
Yes. How is the name? In Spanish, what is the name? ¿Cuál es el nombre en español? ¿Antifebril?
Antipiréticos.
I think it's the same. Antipyretics, antipyretics, something like that. Let me check. Continue.
Tenemos, bueno, metimazol, paracetamol.
Yes. Antipyretics.
Antipyretics.
Yes, I will write it to you. Antipyretics. Okay, so you can remember.
Okay, teacher.
Okay, continue, please.
Teacher, analgésicos.
Painkillers or analgesics.
Analgesic.
You can call them painkillers too. I will write it down. Painkillers. Like that. Okay. Okay, continue.
Painkillers, morfina, teacher, como
Morphine.
morphine, tramadol, me olvidé, teacher, cómo se.
No, it's okay. It's the same name. Tramadol. Just the
Tramadol.
pronunciation.
Tramadol.
Oh, your, your dog. Tu perrito me está volviendo sorda. No te preocupes. Ok. Weimar, está bien, estamos avanzando, poco a poco estamos avanzando, ¿ya? Lo único malo es que nos falta tiempo. La práctica te va a ayudar un montón, vas a mejorar claramente, pero el tiempo es el problema. Necesito, como le decía a Jocelyn, que practiques con ella, ¿ya? Pueden hacer videollamada, revisar los videos y practicar juntos. Eso les va a ayudar un montón porque ya va a ser el examen también para pasar al otro nivel. Entonces sería bueno que practiquen, por favor. No se descuiden de eso. Ya va a ser inmediatamente, creo que este lunes. Voy a decirles a más tardar mañana en la mañana para que tengan estos días para estudiar. ¿Ya?
Okay.
The last thing I will ask you is to choose one of the mental illness that we talked about. Choose one and describe it to me.
Enfermedades mentales, teacher, cualquiera.
One of the mental illness. Depression, anxiety, what else? What was it? I don't know. Bulimia.
Epilepsy,
right?
teacher.
Epilepsy, okay. Try to describe. I will help you.
Depresión también.
Okay.
Bueno.
Whichever you want.
Epilepsy, it is a disease of the nervous system due to abnormal electrical activity in the brain.
Okay.
Characterized by
once again, characterized okay
by jerking movements, voluntary movements, blackout, confusion.
Yes.
Rigidity.
Rigidity. Yes.
Okay, teacher. Teacher, ¿cómo se diría estatus post-epiléptico?
Post-epileptic status.
Post-epileptic status. Insomnia, Fatigue. In the treatment is phenytoin,
Phenytoin.
valproic acid, ácido valproico,
Okay. Yes, deltoic acid.
carbamazepina, teacher, no.
Carbamazepine.
Carbamazepine.
Uh-huh.
So sería, teacher.
Okay, that's good. That was good. Está muy bien. Está bien. Por lo menos si has leído, Weimar, has leído bien. Has mejorado también. Es bueno que no tengas vergüenza de la pronunciación, ¿ok?
Ok, teacher.
Siempre que te digo repite porque nuestro cerebro se va a acostumbrar. Va a ser un hábito. Y la lengua también hay que acostumbrarla. Igual el oído. No es rápido que uno dice, ya voy a hablar inglés y lo hace en un cachito. No, es práctica. Todo es práctica. Cómo tocar el piano, cómo jugar fútbol de la mejor manera, ¿no es cierto? Entonces, práctica. Que tienes que practicar. Ahorita mismo te voy a pasar unos videos que te pido, por favor, que son de TikTok, ¿ok? Para mejor pronunciación. Y vas a ir revisando, lo vas a ir siguiendo a este chico o chica, creo que son dos. Y le vas a pasar a Jocelyn también, por favor, para que ella también practique. ¿Ok? Y mañana nos vemos contigo, igual un poco tarde. Mañana, obviamente, la clase teórica es de 8 a 9 y después a las 10:30 contigo. ¿Está bien?
Okay, teacher, no problems.
Perfecto. Entonces te voy a dejar casi me voy sin lanzar mi cuestionario. Por favor, te pido que lo llenes. Can you fill my questionnaire, please? Okay.
Yes,
Thank you so much. Oh, no. What is happening with my... And one more. With the second part. Okay. Okay, thank you so much, Weimar. Have a great night. I hope you can rest. Okay, see you tomorrow. Bye-bye.